Diabetes mellitus, also referred to as DM, is a chronic metabolic disease that requires lifelong behavioral and lifestyle changes. Diabetes is a major public health problem, and its complications result in hypertension and hyperlipidemia. In the USA, DM is a leading cause of blindness, end-stage renal disease, and foot or leg amputations. After this lesson, you will be able to identify safe and accurate components for insulin administration and other anti-diabetic agents, comprehend individualized patient teaching methods for diabetes management, compare the risk factors, age of onset, manifestations, and pathologic mechanisms of type 1 and type 2 diabetes mellitus, evaluate laboratory data to determine effectiveness of the prescribed dietary, drug, and exercise therapies for diabetes, and explain the effects of insulin on carbohydrate, protein, and fat metabolism. The pancreas has mostly exocrine functions that are related to digestion and endocrine functions that are related to blood glucose control. The endocrine portion of the pancreas has about 1 million small glands. These are known as the islets of Langerhans. The two types of islet cells important to glucose control are the alpha cells, which secrete glucagon, and beta cells, which produce insulin and amylin. For all types of DEM, the main feature is chronic hyperglycemia resulting from problems with insulin secretion, insulin action, or both. The disease is classified by the underlying problem causing lack of insulin and the severity of the insulin deficiency. Glucose is the main fuel for the central nervous system cells. Because the brain cannot produce or store much glucose, it needs a continuous supply from circulation to prevent neuronal dysfunction and cell death. The process of insulin release and glucose control is through the negative feedback system. This image to the left indicates that there is a stimulus that increases the blood glucose level, sending a message to the pancreas that there is an increase in glucose levels. The pancreas secretes the hormone insulin, causing liver cells to take up glucose and store it as glycogen, while other body cells also take up more glucose. As the body cells take up blood glucose, glucose levels in the blood decline and insulin release stops. This other image located to the right of you is the body's processing related to either low blood glucose or high blood glucose. Basic causes of diabetes mellitus are related to insufficient production of insulin, production of defective insulin, or the inability of cells to use insulin. There are two main types of diabetes mellitus, type 1 and type 2. There is also gestational diabetes mellitus, which we will be covering type 1 and type 2 in this lesson only. Type 1 is insulin dependent, and it is usually juvenile onset. Type 2 is non-insulin dependent diabetes. Onset is in adulthood. The two types of diabetes mellitus in type 2 are obesity-related diabetes and insulin-resistant diabetes. Type 1 diabetes mellitus is where the pancreas undergoes an autoimmune attack and is rendered incapable of making insulin. There can be environmental triggers that stimulate this immune attack against the beta cells. It could also be genetically inherited. It tends to occur in the young, lean individuals and usually before 30 years of age. Peak age is during puberty. So we discussed the etiology that it could be a genetic predisposition. It could also be caused from a viral trigger that causes the autoimmune destruction. It could also be because of removal of a pancreas. And then abrupt onset will display signs and symptoms of thirst and hunger and frequent urination, weight loss, and fatigue. And it's also usually responsible for 10% of all diabetics. Treatment includes insulin by injection, teaching patients proper diet, proper exercise, providing the patients with education, and monitoring. This image provides the clinical manifestations that are associated with type 1 diabetes mellitus. These clinical manifestations are polyuria, polydipsia, polyphagia, weight loss, fatigue, increased infection frequency, rapid onset, insulin dependent, familial tendency, and the peak incidence is from 10 to 15 years of age. Type 2 is characterized by insulin resistance, as the body cells do not respond appropriately when insulin is present. There is a cell receptor defect. Glucose is unable to be absorbed into cells for the fuel of the body. It compromises approximately 90% of all individuals with diabetes. Onset is after the age of 40, and that is presently changing. Now it is increasing more rapidly in adolescents and young adults than in the other age groups of the elderly. BMI is the strongest indicator of DM. So the etiology linked to type 2 would be hereditary, obesity, decreased insulin production, faulty insulin receptors, or even medications, long-term use such as steroid use. There are many risk factors. For one, age. Usually if they're older than 45, it's a little bit more difficult for them to treat. Another risk factor is obesity, family history, cultural ethnicity, hypertension, dyslipidemia, and then, of course, history of gestational diabetes or delivering a baby who weighed more than 9 pounds. Treatment will definitely include diet, exercise, insulin, and monitoring. They may also be provided with oral medications. So you want to make sure that you're familiar with these treatments so that you can educate your patient and monitor your patients. This image depicts the clinical manifestations and lifestyle tendencies of type 2 diabetes mellitus. These are sedentary lifestyle, familial tendencies, and occurs usually at the age of 50. History of hypertension, fatigue, decreased energy, obese, and recurrent infections with antibiotic use, polyuria, polydipsia, and fasting blood sugar greater than 126. Oh no, we have the metabolic syndrome, also called Syndrome X. It is the simultaneous presence of metabolic factors known to increase the risk for developing type 2 diabetes mellitus and cardiovascular disease. Features of the syndrome include abdominal obesity, hyperglycemia, hypertension, and hyperlipidemia. This is the end of Part 1 of Module 3 of Alterations of the Endocrine System.